and welcome to this edition of A Conversation With. I'm Jim Marshall of the New Bedford Cable Network, and in studio today she's back. Cheryl Bartlett from the Greater New Bedford Community Health Center joining us again. It's good to see you. I emailed you last week, and I think my line was, everybody's sick, and I mean everybody.
Everybody is sick.
So it's great to have you on talking about certainly the flu and cold season right now, because we seem to be in the midst. We seem to be getting I don't know if a surge is the right word, but it does seem like everybody's sick. And a lot of people have said that just out and about, like, oh, so-and-so sick, so-and-so sick, everybody's sick. So it's crazy right now that we seem to be dealing with that. And it's not necessarily COVID. It seems to be the flu.
Seems to be a combination. I think we had... There's been a lot of COVID, so we had quite a few people sick after the holidays, which we've seen over the 4 years now of COVID, that the holiday gatherings in homes, as we were talking earlier off air, that small, lower ceilings, more congested gatherings is a good place for COVID to transmit. So we had quite a few staff out early after the holidays, and now it seems to be more of a cold and the flu. So 3 things at once, right? Well, actually 4. If we add the cold, we've got respiratory syncytial virus. That seemed to be earlier in the fall. And then COVID and flu combined together. And then just the plain old everyday cold that we kind of forget about because we were so focused on these 3 big ones.
And it seems, too, that from I can speak from my house. I know my wife was sick around Christmas, then my son got it, then I got it. And it was the flu. My son was the one who went to urgent care because he just was not feeling it, and they're like, no, it's the flu. They tested him for everything else, but it does, once one in the house gets it, it seems like it's going to go through the house too, not surprisingly.
Yeah, and we are also seeing that in small departments within the health center. If a couple people get it, it seemed that we were seeing multiple staff get it. So we went to masking once we started to see that right away, and then in general we have gone back to masking. We're strongly encouraging patients, not forcing them as we did early on in COVID, but we're requiring all staff that are in a clinical close area to wear masks.
So talk a little bit about you talked about RSV briefly in the fall. What are you seeing right now as we're in January right now, the post-holidays, but again, like I said, the flu is high. So what kind of cases are you seeing in the center right now?
So we are seeing a much higher percentage. We're in the high double digits. I'm going to say 20 and 30% of people that test for these viruses are testing positive. Now, sometimes that's a small number of people that get tested. If you look at the trend over the last 4 years, we did have a big, huge bump right after the holidays, but then it kind of came down quickly too, which is what we're seeing. But it never seemed to spike quite as high as it did a year ago. So high, but not as high, coming down more quickly. And but on top of that, flu, whereas we didn't see flu for a couple of years during COVID because people were masking. If you remember, when we were masking, people didn't have a lot of respiratory illnesses.
You and I look back, you and I were talking about that,
right,
that the flu and common cold were not really common during COVID.
Correct.
And I think people forget that.
Yes, and even allergies, people that have environmental allergies, if you were masking, then you didn't have those allergy reactions. So it's interesting. So masking is still a very good thing, whether someone else is masked or not. If you want to protect yourself or protect your family, wear a mask.
Did you notice at some point, because we haven't chatted in a little bit, when things started to, for lack of a better word, pick up? Was this before the holidays out? Because it always does it around the holidays, and you've talked about that. But did you notice anything coming into the fall or early winter season?
Well, I would say that I had COVID for the first time in late October. So we do start to see a little bit of a bump in September, starts getting cooler, people start coming inside for their gatherings. And so we started to go up, but not significantly. Thanksgiving, Christmas seem to be the biggies when people really come together. And I think because we didn't travel for so long, I feel like travel has also increased significantly. So people are being exposed in airports with hundreds and hundreds of people traveling, and masking not required anymore. And having traveled recently, I didn't see, I would say if I saw 1% of people with a mask on, that would be a lot.
One thing too is as they talked about the cold, the flu seemed to be the big thing too, with the characteristics: dehydration, high fever, shortness of breath, body aches. Have you seen people who have those symptoms, but those are the symptoms similar to COVID too?
Correct. So I think that everybody immediately, of course, goes right to COVID. And the other thing that's hard to totally measure the true impact of COVID is because people can home test for that, we don't have the reports of those cases. So it's probably higher than we even know about because of reporting artifacts. So very challenging, but a lot of similarities, although I will say that COVID has some distinctions. I think the fatigue seems to be pretty overwhelming with COVID, and people that have respiratory conditions on a good day and get COVID, that seems to be where they get hit hardest. And I think this round of it seems to be a little bit more severe than it was last year after people were getting vaccinated. One of the things the vaccine does is it isn't just about trying to reduce the number of cases that we have, it reduces the severity of illness. And so many people haven't gotten the recommended next booster, which they recommended quite a while ago.
Well, and I'll be the first to admit, I know I haven't got it yet, but the availability of that is different than what people have been saying.
Right.
I know I went for my physical in December. It's not offered right now.
Right. It's no longer free.
Correct.
And so people aren't stocking it because you have to now pay for it. So if a doctor's office gets it, there are expiration dates to it and certain ways that you have to store it. And so that makes it more challenging when you're not doing it through large clinics the way we were doing it in the early on in COVID.
Is that something that, obviously it seems that does contribute to the problem?
Yes. But pharmacies do have it. Big pharmacies like Walgreens and CVS should have that available. I don't know how much they keep on stock, but because you can just go in there without a prescription for it, you can get it at a local pharmacy.
I know the city, and you were involved, I know the city did a tremendous job during COVID getting those clinics out and about for everybody.
Yeah, we were doing 300 people a day. In one clinic, I think we did 1,000 people. So yes, so you can plan better for that. So vaccinations have some amount of preparation, planning for practice to have available.
Do you think that contributes to the people not getting it because it's just not as it's not offered like it was before?
Absolutely, and also we promoted it like heck when we did that before, right? We were on the radio, we were wherever we could be offering them at any kind of social gatherings. If there were going to be more than 50 people, we'd set up a table and vaccinate.
I mean, you guys would send out the notices like, here is where. I mean, we'd put them on the bulletin board here or something like that.
I mean, we had the city doing it, we were doing it, you had South Coast doing it, so there was a definitely large concerted effort. So it does take a little bit more time, but it is available. I just had mine finally too. I was going to wait till the fall. I get sick every time I take it, so I also mentally was saying, well, when do I want to have 2 days where I have to be in bed and not as functional? And so of course then I got COVID before I got the vaccine.
When you're talking to people, do you find that right now that they feel COVID is just in the back burner and what have you, like we're not going to worry about it anymore?
Yeah, I think the anxiety level is definitely different. But as you say, I talked to somebody yesterday and they said their whole family, extended and all, because they all got together. Football is another time people get together for football games. So I'm assuming the Super Bowl will have a little bit of a bump in it too with Super Bowl parties. But I don't think it's on our consciousness on a daily basis and thinking about it.
Well, you were talking about off camera, you were talking about vaccination fatigue, which, you don't even think is anything, but, oh yeah, it seems to be something right now.
Yeah, they say in all kinds of public health epidemics, when you're constantly telling people what they can't do or what they have to do, after a while you get tired of doing it. And I do think people are, the masks, some of our patients absolutely do not want to put a mask on, so that's why we made it sort of strongly encouraged. I don't want to be fighting with patients who need to get care to say we're not going to take you in, so we made a conscious decision that we need to get people in and treat them.
Do you find patients tell your staff, do they say, yeah, we're going to pass on the
We have a mask. On the vaccination, yes, yes, absolutely.
Yeah. It's interesting, too, because we were talking off camera, but so as of January 12th, and I saw this from the CDC, they report 14 million people, again, nationwide, have had the flu as of January 12th. 150,000 hospitalizations, 9,400 deaths, including 40 children and teens. And I did note that while elderly and children are impacted, and we've talked about that in the past, it said that they're seeing an increase in people 20 to 40 years old getting the flu. And that was never something that was never an age group really that seemed to be impacted really by, they could get COVID, but it wasn't one of those core groups that people worried about. But it seems, at least with the flu here, that is an age group that is being impacted.
Yes, and I mean, they have been impacted before, probably not in the numbers. Again, if I looked at some of the travel numbers, I think this year for Thanksgiving, I was seeing that it's always one of the busiest travel weeks of the year,
right,
but that even surpassed pre-COVID travel numbers. So I think that people, after being cooped up for 4 years, they say travel to Europe is out of control, that people that couldn't travel for 4 years. Again, I feel like we're doing all the things that we couldn't do, and we're doing them en masse, and we're doing them without masks.
Right.
So, and I think another thing we stressed a lot was the sanitizer. If you remember, sanitizer was everywhere, and so you stopped and washed. And hand washing is actually one of the single most important things we can do to not have respiratory infections. We touch things, we touch our face, and the more you can wash your hands, 20 seconds of friction with soap. It doesn't necessarily have to be a sanitizer, but we were way more sanitizer thoughtful during COVID.
It was everywhere.
We were, yeah.
But so, and I remember, you talking about, people had them on their desks, they had them in businesses had them right in the lobbies or what have you.
Yeah, and we had people watching. You couldn't come in without a mask, and we had to see you put on sanitizer. So a lot of the old ways, and hand washing is something that one of the best things that ever came about in terms of improving public health.
I know that we talked about COVID shots, but the flu shot has been available everywhere. I did get a flu shot. Doesn't mean I didn't get sick. It's one of the things that, and the doctors I know emphasize all the time, and you've emphasized this, the shots don't prevent it.
Right.
They prevent severity.
Correct.
And that, but a lot of people aren't getting even the flu shot. We were talking off camera. They said, again, nationwide, 10 million less flu shots administered this year than last year at this time.
Yeah. So one of the interesting things, just even with the COVID vaccine, is there was a lot of confusing guidance coming out of the federal government around that. First, they kind of were downgrading their recommendations that people didn't have to apply for exemptions anymore. Before, if you remember, during COVID, you had to get it, and particularly in some businesses that mandated it, but particularly in healthcare, unless you got a physician's exemption or a religious exemption, and somebody had to review them and decide if your exemption was valid. Now they're saying all you have to do is sign a declination form. Well, that makes it a heck of a lot easier to decline doing it. So we require it, but you can decline to get it. And so that brings down your numbers pretty radically. We had almost a 95% or higher rate of vaccination. And I don't know what it is now, but I can tell you it's not close to that.
I know it's interesting. I saw, too, in this report, Canada, I saw another report, Canada researchers said that the flu shot is actually a good flu shot this year. It's like 61% effective for adults, and it's very effective for kids, 75% for kids 9 and younger. And they say that is those are really good numbers.
Yeah. Massachusetts has always had a decent flu shot because we've, over the years, added the multiple variants of potential flu that you can get. There's obviously different variants of flu like there were with COVID, and so it depends on which flu shot you get in a year, but over time Massachusetts has kind of put every kind of potential variant in that flu shot.
Well, as I recall, you were telling me too, in a sense, when they're developing the flu shot for the upcoming year, it's kind of guesswork, really.
Yes.
You've taught. I think COVID you mentioned is sort of the same thing. They're kind of guessing what the strain is going to be, if I'm not mistaken.
That's what they did early on, and they were sort of going with that RNA messenger, if you recall, because the virus has RNA messenger. And so, but then they got all the different variants, and the newest vaccine covers for the more recent variants that we have. And there is some conversation going on that by next year, it may be one shot that we get a COVID and flu shot combo, which would be nice.
Oh, wow.
One shot, one vaccine, hopefully take us through the season. That would help a lot. I just had my flu shot, my RSV shot, my COVID shot. I got the updated shingles shot.
I got a
now
shingles
I'm
shot.
Old
That hurt.
Yeah, that really hurt.
Yeah.
And we have to get it when you get old. You have to have the old
Yeah,
persons.
I know.
My doctor was like, you have to get the old persons. And then I got the newest pneumonia shot because of age too. So it's like, that was like 5 or 6 shots within a month's time, which...
Do you think that, because flu shots have always been around, do you think, so we're going to end up having to take a COVID shot or something for COVID every year?
Oh, I think so, yeah. And as I said, the research that's going on is to try to combine the flu and the COVID into one injection, which I think would really help with compliance.
Yeah, because people just, they don't want the shots.
Yeah.
If you can lessen it.
Yes.
I know that when COVID first hit, you had the Johnson & Johnson shot, which was one shot.
Right.
But Moderna, and I forget the other one.
Pfizer
were 2 shots.
Yes. Right.
But Johnson wasn't, quote, effective as the other 2. I mean, it was all minuscule.
Only, but I know.
But
people
still.
made a big deal. That eventually, I'm not even sure that's available anymore. I don't think it is. I think the other was more effective. So I think it's Pfizer and Moderna again.
But you're looking at it from your perspective that is going to be
yes.
one of the shots that you're going to have to get.
Yeah, I don't think we're going to see this virus go away in any way, shape, or form.
The other, so we were talking COVID too, and just looking at the numbers for the week of January 1st through 13th, you had 4,400 new cases, 40 deaths. That's COVID as of January 18th. That's 1 week.
Right. State of Massachusetts.
State of Massachusetts, yep.
Yeah.
4.2% of all hospitalizations were related to COVID.
Right. Which is way down, though, to keep it in perspective.
Correct.
Because that's one of the factors we look at in terms of escalating the masking. And it didn't go up, again, quite as significant as it was in the peak of the epidemic.
No,
but
the
it
numbers
began to go up enough that I think we said to ourselves, it's time to mask. So right now, I think there's a variety of practices going on. Some people are across the board mandating staff in, patients coming in health facilities. Some are leaving it voluntary, depending on what your circumstances at work are. We're recommending anybody coming in face-to-face with patients, because patients can come in for something else and still have a respiratory virus. They may not think that that's what they're coming for, but sometimes once you get them in the room and start asking them what all the things are that are going on, you realize, oh, they also do have a potential for COVID or flu.
I know, as you talked about COVID, I mean, there was, and kind of just to summarize what you were saying earlier, there was an increase right up until last week was the first week it dipped.
Yeah.
COVID cases.
Yes.
But it was a steady increase for almost 8-9 weeks, it looks like.
Yes.
I guess that,
right.
when you think about it, that's Thanksgiving or right before it.
Exactly. And the other thing that I think we have now that we didn't have in the beginning of the epidemic was that they can monitor COVID in wastewater. And so that usually you start to see rise before you start to see illness in the general population. And so that's when people started paying attention, when they saw huge surges in the wastewater containing COVID.
Is it still good to get your flu shot right now? Still ideal?
Yes. We can have the flu right through early spring.
And you would advise it for kids too, right now?
Yes, absolutely.
I know my wife said in her school, it's a lot of kids are out sick.
Yeah.
But I mean, they're in a confined area, right, and they're kids.
Right, exactly.
As Kim says, it's a petri dish for
Correct.
everything.
Right.
But you still would advise folks, if they have the opportunity, get your flu shot.
Correct, and the COVID shot. Because COVID usually stays pretty good. It should go down to be less of the height that we're seeing right now. But again, we'll have the Super Bowl, so people will come together. It's still the winter where we're gathering inside, and so I don't think we'll really see the numbers go back down to numbers that we don't have to be as concerned about until the spring.
You got a pneumonia shot. Now, what's
Yes.
that? I mean, so the characteristics of pneumonia, what are they compared to the flu or COVID? It seems like they're all the same.
Well, they are, but pneumonia is more often bacterial. There are viral pneumonias and bacterial pneumonia, and the pneumonia shot is for the bacterial. And they have, those were, I want to say they were every 5 years, but there also is a more rigorous shot for those of us that are aging that will hopefully boost our immune systems diminish as we age, and so giving us a little bit extra dose to get our immune system.
And how often do you get those?
I think that they are, if they're either every 5 years, or maybe I'm hoping it's one and done, but I don't know. I had a pneumonia shot. I think when you are over 50, you get your first one. And now I hate to say that I'm pushing 70, but they told me I needed the old person's.
But it's funny because I haven't heard too much about pneumonia right now.
Yeah.
I don't know if you see that.
So a lot of times viral illnesses can turn into pneumonia, because what it basically is, when we have respiratory symptoms, you have runny nose, rhinitis we call it, you can get a postnasal drip that goes into your lungs. If you're having any kind of respiratory difficulty, that can kind of overtake your lungs' ability to exchange oxygen, and it basically is a fluid buildup in your lungs. And so that oftentimes, when someone gets very sick with a respiratory illness, we watched for a pneumonia to take over. Because when that liquid sits there, it's a petri dish for bacteria, right? Because you're not moving that along.
I remember my sister, when she was really little, she'd get pneumonia a lot, actually, as a kid. And this is, 50 plus years ago. But it's funny, I don't really, when you hear about the flu and COVID and stuff, I just don't hear a lot about pneumonia anymore.
It's not as easily transmitted in the air the way that these viruses are. Mm-hmm. So you have to have a much closer contact, and people can be treated much easier than they used to be.
Before, I got one more quick thing I want to go, but just for people right now, what is your advice right now, just for precautions as we continue with the cold and flu season right now? We've kind of talked about them separately, but...
Right. So I'm going to say wash your hands all the time. The more you wash your hands, the better. Everything we touch has some kind of virus or bacteria on it, and then we get exposed to it. Get up to date with your vaccines. If you have people in your family that have any kind of respiratory illness, I would recommend you mask. And if you get any one of these, you should stay home. And with COVID now, they're recommending 5 days at home. And if you're asymptomatic after 5 days, that you can go out with a mask for 5 days, but that we still is about a 10-day quarantine period. And
I have noticed, by the way, that when people do seem under the weather and they've been out or whatever, even when they come back, I know here in our office, people are wearing masks.
Yes.
Just common courtesy, I guess,
Yes.
what really is what it is.
Yep, I've been around family recently and they've had just regular colds, so I think that that's a really good thing. In the old day, we used to tell people would go to work sick, and now we don't know what it is. So when I see people at work with respiratory symptoms, I tell them, and getting tested, test to make sure it isn't COVID,
Right.
so that we don't either assume it's a cold or assume it's the flu. Let's make sure it is, because COVID has a more distinct isolation period.
And the federal government is still giving out free tests.
Correct.
Just go to the government website. I think it's
Correct.
cdc.gov, and you can get, because I know we ordered some.
Yes.
Yeah.
We have them too. We're giving them out to staff. And so testing, because I think we're, again, not as cognizant of us having COVID, and I don't want to get it. So
Yeah.
when I see people with symptoms, I'm like, you better test for COVID because you're going home if you have it.
Right. Quickly, I just wanted to touch base, put your business hat on and stuff, and I asked you this off camera too. You see a lot from the state right now and down in Washington about cutting health care. It's too expensive. Yet you've got this, you still have COVID. You see a surge in the flu. What's your take when you hear lawmakers, officials talk about that? And in a sense, what's the impact, do you think, on an organization like yours, which helps thousands of people?
Well, we rely on federal government funding as well as state government. And so when the federal government starts talking about closing down, I do get nervous about that, because we rely on that funding to stay open. But I have seen over the years that that's often a political tool for each party to kind of spa with one another, and I feel like, at least from a community health center perspective, that both parties support community health centers. We take care of the most vulnerable people in every single state and community across the country. So I'm less worried about the federal government. Right now in Massachusetts, during COVID, they stopped people having to re-enroll every year in Medicaid. And so this year, everybody had to get eligibility review, and a lot of people got off of Medicaid. They made too much money,
Right.
or they worked somewhere where there was benefits, so they're getting on insurance plans through the connector, which is sort of the safety net for insurance in Massachusetts, and that has higher deductibles for the individual's premiums. And so we're seeing people not enroll in insurance, which means they're uninsured. We see people regardless of their ability to pay, but not everybody does. So that means people will get less access to health care if they're not either on Medicaid or they don't re-enroll in another product. So that's a little concerning, for sure.
Right, and the need, because I don't want to say growing in that regard, but your clientele is growing.
Yes.
Unfortunately.
We serve about a quarter of the city's population. And healthcare is rising. I get that the federal politicians look at that, right? Because you need to be able to control costs to some degree. But I'm actually a very strong proponent of universal healthcare. I feel like Medicare is a pretty well-run health benefit. And if we could have all of our coverage through one program, the cost to me to have to cover every type of insurance, I have to have experts that know how to bill for each one
Yes.
of the different insurers, because some pay for this, some pay for that, some pay for this if you do this, some pay for that if you do
Right.
that. And it's like a puzzle.
Right.
And so we have to employ a whole lot of people. Individual doctors' offices have to do that too. So that totally brings the cost of care up, because we have to include the cost of running our practice to cover all of that work we have to do. So universal coverage to me is the only way I think that we're going to contain the cost of health care.
Quick, for people who have any questions or need some info, why don't you just give them that for the health center?
Oh gosh, you always ask me and I don't remember our phone number. I never
The
call
website's
it.
great though.
It is.
The website's fantastic.
It
Lots
is.
of info on there if people have
Greater
any
New
questions.
Bedford Community Health Center, or we rebranded. We are the New Bedford Community Health. Tried to make ourselves a little shorter and more modern. And yeah, call and we have people that can give information.
Sounds good. It's great seeing you again.
You too.
Thanks for coming in
Thanks for having me.
Sharing the info with us. That's going to do it for this edition of A Conversation With. I'm Jim Marshall of the New Bedford Cable Network. Thanks for watching, and we'll talk to you again soon.